HAPS has been around for 37 years now. It was originally founded by Matthew McKay and Peter Rogers, and
who are our mentors.
Who are our mentors, because Lisa and I met as interns in the clinic. We disagree on the year, but it was in the late 80s.
And now things are changing such that the building is going to be demolished and replaced with residential condos. And I think that's been happening a lot in the city. And so we're forced into this position of either raising the funds to relocate or closing. And quite truthfully, it's heartbreaking.
If you make $1,000 a month and you work at a place like Starbucks and you're suffering with the first round of depression, or you have an eating disorder, or you're anxious about something in your life, or you want couples therapy, then you can come to us. Whereas otherwise, therapy wouldn't be affordable.
There's funding for people who have really no money. They can go to city agencies and be treated. Or there are people who have funds where they can afford private pay out of pocket, or they have insurance that they can use. But there's actually a huge number of people in this area that don't fall into either of those groups and would otherwise not be able to get services.
So many reasons for us to keep doing our work in San Francisco.
Because we are in such a state of crisis right now in terms of trying to identify a location and being able to put together first month's rent, last month's rent, security deposit, moving costs, money to replace furniture, set up a new office. We have big needs right now.
We can't relocate unless we get this money, and that's what we need it for.
If you care about people and you care about their mental health, and if you care about education, and you care about what's going on in the city and want to do your part in whatever small way that is to help stem this tide, then help us to keep going.